chart. Now, let us proceed on taking the respiration level of the patient. And with that, we do not need or we must not allow the patient to know that we are taking or assessing their respiration, because basically, once the patients know that we are assessing their respiration, they might alter their type of breathing. And with that, we might not be able to get the accurate data. So with that, by taking, while we were getting the pulse rate of the patient, we can do it with that. And on getting the respiration of the patients, we have to see on this part, on the sideward of the patient. Let's look on this and we will see how they breathe. For a normal person, we can get a 12 to 20 breathing per minute. So uh, to make it shorter, we can just count for 30 seconds and then just multiply it into 2. So for these patients, I was able to record 14 breathing for over a minute. And after that, I will be putting my the vital signs here, after the assessment for respiration. Note that every time that we are going to take a vital sign of the patient, we have to remember to put it and list it on our chart. Okay, let us now proceed on getting the blood pressure of the patient. On getting the blood pressure of the patient, we have to remember a lot of things, and this includes the sitting position of the patient. It must be sitting properly and not lying down. And of course, we have to observe the patient if she is in good condition, if she is relaxed. Otherwise, if she is exaggerated or she is playing too much high emotion, we have to allow it to stay calm first. And on getting the vital sign or the blood pressure of the patient, we have to note that the arm is just level on level of the heart of the patient. And we have to note that on getting that, we can use right or the left part of the arm. And here we have the blood pressure paraphernalia, which we will be putting over the arm of the patient, like that. And note that we have here the basis, which will help us to identify where are we going to align or position this. And since we are using the arm or the left arm of the patient, we are going to locate this part, which is the left arm, on this part of the patient. Here on this part, the part where we can hear properly the pulse rate or the blood pressure rate of the patient. We'll be putting it over like that and close it properly. We have to note that on putting this paraphernalia, we cannot lock it too tightly because it might affect the basis or the result of our uh, test. And also to know that it is just perfectly fine or perfectly intact with the arm of the patient, we can use our 2 fingers or 3 fingers and slip it over the patient's arm. And since I have noticed that it's just perfectly working, we have nothing to worry about it, and we are going to use this stethoscope for us to be able to hear it properly and put it over the part where it says left arm. Put it over here. Why here? Because there is an artery here that will allow us to hear the part or the blood pressure rate of the patient. Let's put it like that. And note that this gauge is very helpful because this will allow us to see and to know the diastolic and systolic of the patient. The normal systolic and diastolic or the blood pressure rate of the patient is over 180 over 120 over 180, I'm sorry, and we have it to put it over here where we can see it more properly. And let us now wear our stethoscope. And by here, using this part, this is the part where we can pump it and then get the accurate blood pressure. We have to lock this part. There's something small here that will lock the air going to this. So we are going to pump it until 130, and then I inflate it. So since it reached 130, we are now allowed to release it. With that, we can hear two sounds, which includes the systolic and the diastolic. The first sound that I heard was over 110, and that is the systolic. And the second sound that I was able to hear was on the 70. So the systolic and the diastolic, or the blood pressure rate of our patient, is 110 over 70, which is just normal, since the normal systolic and diastolic is 120 over 80. So after that, we are now going to remove the cough of the patient. We have to remove this first. And we are now able to disinfect or clean our paraphernalia. And after that, we have to keep our data on our chart, and do not forget to put all the details that are necessary for the diagnosis of the patient. So that is how we get the blood pressure of the patient. We are officially done with taking the vital sign of the patient. And of course, as nurses, we have to be very smart on putting and gathering the data for or during the vital signs gathering, because of course those vital signs plays a vital role on the diagnosis of the doctor for the patient. And in getting the vital signs, we have to be very smart and keen, and cannot neglect any single detail of our observation to how we get the patient's vital signs, because it will affect the diagnosis of the doctor to our patients. And that ends my presentation. Again, this is KYLENE MAE G Tambaling of BSN1C, presenting to you my written demonstration for the vital signs. Thank you and have a blessed day.